First order bends are those in the horizontal or vertical plane. We will first start by placing a step up and then a step out for a specific case situation. Let's first describe a technique for making a step bend. Grab the wire with your plier and make a bend with your finger around the plier at about 20 degrees. Next, move your plier to grasp the wire just past the first bend, and using your finger, bend the wire back to be parallel to the starting plane. Now take out the 018 by 025 stainless steel wire or a similar rectangular size wire. Starting with rectangular wire will keep you in the correct plane when bending. Make a mark on the wire with your marking pencil and grab the wire at the mark with your plier as shown here. Always bend the wire towards you or away from you to be certain you are in the correct plane. Make the first bend of approximately 20 degrees. Move the plier to a position just past the first bend and now bend the wire back to the original plane. To complete the step down for an individual tooth, do the same in reverse. Bend the wire again at an angle of 20 degrees up. Move the plier and bend the wire back to the original plane. Both legs of the wire before and after the step should be in the same plane if the steps were of equal size. You can check this by placing the wire on a flat surface. The size of the first bend will determine the size of the step. A 20 to 30 degree bend will result in a medium step of approximately 1/2 millimeter. A 10 to 15 degrees bend will result in a small step of approximately 1/4 millimeter. And a larger bend, let's say maybe 45 to 60 degrees, will result in a large step of 3/4 millimeters or so. Now in your wire, you may make a small, medium, and large step. Most of you will make the large step too large in the beginning. In the mouth, you will not be able to re-engage the wire into the bracket slot if too large a step is made. If an error, always make too small a step. Then the next month, the step can be made larger. Your wire should look like this. Let's now see the practical use of such bends. On this patient, the lower left lateral incisor needs to be stepped up, and the lower right lateral incisor also needs to be stepped up. We will first mark the mesial and distal with a wax marking pencil, indicating where to place the bends. This patient has already had some bends placed in previous months. Ignore those bends, making the exact bend that you want for this month in the wire. Make the bend over the top of the old bend. Otherwise, you will have too much wire bending in between each bracket, making the inner bracket distance too small for the arch wire to slide back and forth. On this case, we are incorporating a little bit of root tip or some second order bending to get one of the corners up a little bit higher than the other corner on the mesial or the distal. You just replace the wire and force the wire back into the bracket slots. Now let's see this patient the next month. This is after 1 month in the arch wire. You can see now that the lower incisors look much better.
We will now compare the initial study models with the finishing of the case to date. We will compare contact by contact to be sure that each tooth has been fully corrected. Ask yourself where the case may relapse in retention. If anything, you would like to have more than a full correction or an overcorrection. On this case, you can see there's some cuspid rotation.